We're at iMedical Equipment and Service, and we're here with some guests that have come in, and I'm with Dr. Is it Okolo Joseph?
Yes.
Dr. Okolo Joseph from South Sudan. And Doctor, thank you very much for taking the time today to come and visit us. It's been a pleasure to bring you through and show you all the equipment. I know that you've got hospitals and places you work for in South Sudan. I want to get the George Clooney story, but before we do that, tell us a little bit about your work there and the hospital that you work for in South Sudan.
Yes, like my friend here has just mentioned, I'm Dr. Okolo Joseph. I am a Ugandan, but working in South Sudan. The reason why I went to South Sudan is I've always preferred to work in very difficult areas and areas where there are no doctors and there are no hospitals, because most people there suffer, but my presence will always save lives of the people who would have died for no good reason. So I'm actually a founder of the Genesis Medical Center, but the mother company is the Genesis Health Services. So we are based in Juba, in South Sudan. So we have been operational since January 2010, so we're about 10 years now. So our health facility is, if you wanted anybody to talk about private sector health in South Sudan, possibly I will be number one. If you want the first top three, the Genesis is always a part of them. Yeah, I remember 2012, I think, George Clooney came to South Sudan. He was the guest. He was the guest of the country, and he fell sick. So they tried to help him, but they didn't actually manage to help him. So the president was told about the Genesis and Dr. Krut. So I was picked by two ministers from the Genesis Medical Center where I was working. Actually, by that time it was midnight, and I was still working. And they told me, there is a guest who has a problem and we have been told that you can help. So I accepted. We went to the camp. That camp was Afex, where he was residing. So we went there. I found he was really in a sorry state. And I just asked two questions. When did you come to Africa? Because I wanted to exclude malaria. He said about 5 days. I said malaria out. Where were you? Nuba Mountains. What happened? We ran short of water. And you know, South Sudan and Sudan are very hot. So I just realized it was electrolyte imbalance due to lack of water and loss of the nutrient, the micro, let us call them what? Minerals. Mm-hmm. So because if you don't have sodium, don't have potassium, your muscles become crazy and they stop, cramped, and you can't operate rightly. So we replaced the electrolytes, and in 30 minutes, George Clooney got up, and he was like, "Where did you train from?" I said, "From Makerere University in Uganda." "The university must be good." I told him, "No, the university is good, all right, but I'm also a gifted doctor by God himself." I was able to tell what you are suffering from in these 2 seconds we interacted. And that was it. And the next day he went to meet the president. And then he flew back and he told me, from here I'm going straight to meet the president of America, who was Barack Obama at the time. And he told me, just Google, "Do you know me?" I told him, "I don't know you. I am a celebrity. I am American celebrity. Just Google George Clooney and you'll see everything there." And I was very happy to have helped a great
That is such a great story. That is such a great story. I love that. I love that. So we've taken you through, you've been able to see a lot of equipment. And why don't you jump in here too, because both of you came down, and I know that your heart is to right now start getting equipment into the South Sudan area. And today we were able to look at a lot of hospital beds and a lot of different things. And I know that you work a lot with infants and delivery of babies. So tell us a little bit about the hopes that you have for equipment and for upgrading hospitals in your country.
Thank you very much. South Sudan has phenomenal potential as a country. It's a new country, got its independence in 2011, July, and the hope for the country is that people would begin to enjoy the dividends of peace. And one of the hallmarks of peace is people access services. They can get good education, water, power, and for a country like South Sudan, health services, which they'd been denied for a very long time because of the conflict that had been going on. So being one of the countries with the highest maternal mortality, any move towards trying to stem the death of kids would be a very big step in terms of improving the health for the citizens of South Sudan. So we've been walking around and we've seen the kind of equipment you have. These are the basics that South Sudan needs at the moment. I mean, on top of improving the capacity of the people who deliver services, we need the kind of technology that we've seen around here, like the monitors for mothers, which will track their labor. We have the NICU warmers. We have quite a number of things here, delivery beds. These are things that we need back in South Sudan to try and help this very big challenge of health in South Sudan.
We so much appreciate you taking the time to come to the facility. That's one of the things that we've tried to do. I know I told you this earlier, but we want to set up the showrooms and get all this equipment on display. So when you come in, you can see it on display. You can test the equipment. We can turn on things like the ultrasounds, the monitors, and you can see the items that we've got here available. And it's so nice when we can have folks like you come in person and work together. And like I said, not only are there items that we know that you need that you'll probably end up taking back, but we showed, and there's a lot of items that we're going to donate and be happy to donate to you as well to help support you. So I just want to take a big moment to say thank you so much on behalf of myself, but everybody here with iMedical Equipment, because it's a team effort that gets everything done with all the biomed certification, getting the equipment. You were just at our big warehouse down the street. You can see how much it goes into getting all this equipment on the hospitals. But best wishes to you on all your efforts on getting everything in Sudan, South Sudan that you're looking for. And we are so greatly looking forward to working with you on all these projects.
Thank you very much. It was our pleasure to come down to medical equipment and see the kind of services and the equipment that you have here. We're always grateful, and if we can do anything to make your organization marketed elsewhere, please let us know.
Yes, and thank you so much, Doctor, also for your fantastic story on saving George Clooney.
Thank you very much.
Thank you, sir.
It's a pleasure.